Good day! I am Augusta Nimerilaga, and this video will be all about dysmenorrhea. Since not all viewers are women, and not all women experience dysmenorrhea, let me begin by asking, how does dysmenorrhea feels like? Dysmenorrhea is felt along with the conditions, namely headache, abdominal pain, menstrual cramps, and if dysmenorrhea is severe, nausea, the urge for pain pills. Well, I feel like I want to murder someone, and also I want soft pretzels. This is not scientifically proven, but it's true on so many levels. All in all, dysmenorrhea feels like kaboom! The objectives. At the end of the discussion, the viewers will learn the definition of dysmenorrhea, the classifications and causes of dysmenorrhea, the risks for dysmenorrhea, the symptoms for dysmenorrhea, the diagnosis of dysmenorrhea, the treatment, and prognosis. What is dysmenorrhea? Dysmenorrhea is painful menstrual cramps at or around the time of the monthly period. Many women get them routinely. You'll feel the cramps in your lower belly or back. They can range from mild to severe. Your doctor may call your cramps dysmenorrhea. There are classifications for dysmenorrhea, namely the primary dysmenorrhea and the secondary dysmenorrhea. The primary dysmenorrhea occurs without an underlying condition. Our body produces chemicals such as prostaglandins each month to help the uterus contract. Menstrual cramps happen because of contractions in the uterus, which is a muscle. When the contractions are too strong, it can press against nearby blood vessels. This briefly cuts off the supply of oxygen to the uterus and causes pain. The secondary dysmenorrhea has a specific underlying cause, typically a condition that affects the uterus or other reproductive organs. An example is endometriosis, which is the growth of functional endometrial tissues in places other than the uterus that often results in severe pain and infertility. Adenomyosis, or the condition which inner linings called endometrial tissue of uterus breaks through the muscle wall of the uterus. The cervical stenosis, or the narrowing of passageway through the cervix. The PID, or pelvic inflammatory disease, which is a condition by which endometrial tissue implants outside the uterus. And lastly, the fibroid, which is a benign tumor of fibrous tissues developing in the uterus. What are the symptoms of dysmenorrhea? Aching pain in your belly, feeling of pressure in your belly, pain in the hips, lower back, and inner thighs. And when cramps are severe, symptoms may include upset stomach, sometimes with vomiting, loose stools, mild to severe pain, cramping pain in lower abdomen or low back, bloating, and headache. What increases my risk for dysmenorrhea? My risk for dysmenorrhea increases if I have never been pregnant, if I am obese, if I have family history of painful menstrual cramps, if I engage into smoking, if I have pelvic infection, if I have long monthly period cycle, and if I have medical conditions such as sexually transmitted infection or endometriosis. How is dysmenorrhea diagnosed? Diagnosis of dysmenorrhea is usually made on a medical history of menstrual pain. However, there is no universally accepted gold standard technique for quantifying the severity of menstrual pain. Yet, there are quantification models called menstrual symptometrics. menstrual symptometrics can be used to estimate the severity of menstrual pain. Based on the results, additional exams and tests may be motivated, such as laboratory tests, gynecologic ultrasonography, and laparoscopy. Laboratory tests may be performed to identify or exclude causes of secondary dysmenorrhea. Examples include CBC, or complete blood count, to search for evidence of infection, ESR, or erythrocyte sedimentation rate, for subacute salpingitis, urinalysis to exclude urinary tract infection, gonococcal and chlamydial cultures, and enzyme immunoassay to exclude sexually transmitted infections and pelvic inflammatory disease. Lastly, quantitative human chorionic gonadotropin level to exclude ectopic pregnancy. Another one is gynecologic ultrasonography, which is a test to examine the pelvic regions using sound waves. Lastly, laparoscopy, a surgical procedure by which an instrument called laparoscope is inserted in pelvic cavity through small incisions. It is used to view the pelvic organs. What can we do to ease the pain? Heat can help. Place a heating pad or hot water bottle on your lower back or tummy. Rest when needed. Avoid foods that contain caffeine and salt. Not using of tobacco or drinking alcohol. Massaging your lower back and abdomen, and exercising regularly. How is dysmenorrhea treated? Dysmenorrhea can be controlled with medicines. These medicines include NSAIDs or birth control medicine. NSAIDs, also known as non-steroidal anti-inflammatory drugs, may help decrease swelling and pain or fever. This medicine is available with or without doctor's prescription or order. Birth control medicine may help decrease your pain. This medicine may include birth control pills or an iodine that does not contain copper. Devices include TENS or transcutaneous electric nerve stimulation, which is a device used to stimulate your nerves and decrease pain. Prognosis of dysmenorrhea. Dysmenorrhea often improves with age, and dysmenorrhea often improves after birth. What have we learned throughout this video? We have learned the definition of dysmenorrhea, the classifications and causes of dysmenorrhea, the risks for dysmenorrhea, the symptoms for dysmenorrhea, the diagnosis of dysmenorrhea, the treatment, and prognosis. That ends my video presentation. I am Agustin Marilaga. Thank you for listening to this video, and God bless.